So some jobs are so stressful, they are linked to increased heart problems in women. Ironically, some are in the healthcare field. Back over to Pete for more on that story.
Well, Vince, a cardiologist, says healthcare workers are usually good at exercising and staying away from smoking and other risk factors that are associated with heart disease. But even so, that doctor thinks the stress those healthcare workers are under puts them at risk of problems, and new statistics back up the claim.
It's a calling, I think.
Ascension Columbia St. Mary's nurse Alexandra Dalio loves her job, but she admits it's an intense one.
We're basically have to be on our game every minute of that 13-hour shift.
According to the American Heart Association, nurses, along with psychiatric health care providers and home health aides, are 14 to 16% more likely to have poor cardiovascular health.
This is the first time we are actually seeing this data come out that people in healthcare are suffering heart disease at such high rates in comparison.
Dr. Sasanka Jayasuriya says the stress nurses are under is probably to blame.
When we take care of sick patients and get to know their families and get attached to these patients, and if there is a bad outcome, we suffer as much as those families do. You just can't let it go and move on.
Dalio says she'd never trade her career for another one, but she's always working on ways to manage stress.
When the stress is becoming too high here, it's reaching out and asking for coworkers or providers or other disciplines to come and help you.
Now, according to the study, other jobs that bring an increased risk of heart health issues in women are social workers, who are 36% more likely to have problems. Also, retail cashiers, 33% more likely, Susan, Vince. So not really a trend there. Although I did notice a lot of those careers, you're on your feet a lot, which you'd think normally you're more active and it should help.